So for this one, we're looking at an arch tape job, which can treat an unbelievable amount of different things when it comes to different pathologies. So one of the most common ones, as pictured above, is plantar fasciitis with any issue with the plantar fascia. The nice thing about these arch ones is you can get highly customizable. We'll cover some basic ones in this that we kind of combine together. This can help with different types of potential neuromas just by supporting through different areas. If you do have some navicular drop and you're trying to train it back, this can also be useful for something like that, or just general foot support when it comes to trying to fit something into a shoe that might be small, typical in football or soccer, or somebody else that wears something fairly small when it comes to footwear. This arch tape job can also be really helpful when it comes to treating things of the lower leg, whether that could be an anterior shin splint coming down tibialis anterior along the anterior side of the tibia, or the posterior medial shin splint, medial tibial stress syndrome, even perineal type issues that you might encounter. This can help recreate the arch of the foot, which can help take stress off these areas. And we often use this as almost a diagnostic, that if this does make some sort of significant impact with that, we may look into something more permanent, such as an orthotic or a different type of shoe that can help prevent these things in the long run without having it be taped on a daily basis or whatever it may be. So this for taping procedure, we're going right to the skin. So we can use adherent, but you do have to be careful because that can leave some residue on the skin, which you can get off with tape remover, but it can be uncomfortable. And also if it gets really tacky, it can also take some skin with it if they have really dry skin. But first thing we're going to do is lay down an anchor strip. From there, we're going to do the teardrop procedure first. So we're going to use either a 1-inch roll, or you can split a 1.5-inch roll in order to get the size that you want. But we're going to work medial, going off the different points, the ends of the metatarsals, bringing it around, working as far lateral, and then start working our way in. And we're just basically trying to make a teardrop right around the calcaneus to support that plantar fascia and the intrinsic muscles of the foot as we're moving through with those. We can then take another anchor strip to make sure that we lock down all those ends so they're not falling off once our patient steps down on top of those strips. Then, to add a second part to this tape job, which you could also do on your own, we're going to do another anchor strip that's going to go all the way around. You can do this from medial to lateral. In the video, we go lateral to medial, but then it gets important that when we're putting on these supporting strips, we do go lateral to medial, especially if we're dealing with something within the arch, whether it be a shin splint or a medial tibial stress syndrome, or trying to help support any of those muscles that are coming around the posterior medial side of the tibia. So I will hold an anchor with my right hand, not put a ton of tension coming through the base of the foot, and then as I'm going and laying it down, just adding a little bit of tension in order to help support that medial arch. This is something you'll have to play with your patient to see what is comfortable in doing this, as you don't want to make it overly tense, which can then tax the system. So then we'll put another closure strip on to hold all of those in place by wrapping around the back of the heel, or lateral to medial in this case. And then we'll also do a closure strip around the forefoot to make sure it stays. If they do get some heel irritation, simple Band-Aid works, heel and lace pad, something to prevent a little friction from the tape on the back of the ankle. Ideally, you want to get all your wrinkles and creases out, just because that can cause irritation. To really wrap this up, you could utilize a flex light, a tape wrap, or a tear light in order just to keep it all together, and you're almost recreating a sock. And then they can still go put their sock on over this and then put it in their shoe.